I'm Dr. Benjamin Cohen, your host, a neurosurgeon who specializes in spinal surgery. And I'd like to welcome back one of our former guests, Dr. Barry Fabricant, or as his patients affectionately call him, Dr. Barry, a chiropractor. And today our topic is going to be lumbar spinal stenosis, another common problem that tends to affect patients probably from their 50s into their 70s and 80s. I like to refer to it as age-related spinal narrowing because it really is a age-related problem. It's an arthritic problem. And how I would define it is all the elements of the spine tend to get thicker. So the spine is surrounded by a disc that may bulge out a little bit more. There's ligament in the back that gets a little thicker. The joints get a little bit thicker. And all summed together, they cause this narrowing or stenosis of the spinal canal. And what that basically does is cause patients to have back and leg pain when they stand and walk. And they tend to get better when they sit or flex forward. And the reason why they get better when they sit or flex forward is because they're opening the space around the spinal canal as they flex or in a sitting position. But when we stand up straight, we tend to, it's almost like a nutcracker kind of effect, where the space gets even more narrow. So patients would rather go on a stationary bike or play tennis, and they don't like to walk or do things standing. And so many patients with spinal stenosis will come to me and they'll have imaging and they'll have the diagnosis. But for whatever reason, they're not in bad shape. They're pretty functional. It doesn't bother them all the time. And so we want to do something conservatively, initially, medically, short of surgery, to see if we can treat them and get them better. And so one of the things that comes up is physical therapy and or chiropractic care. So, Dr. Barry, I'll ask you, I'm sure you see a lot of patients with spinal stenosis, lumbar stenosis. And what's your approach? What do you tell them, and what types of things can you do to help them get better and keep them away from somebody like me?
Fantastic question, important topic. Almost everybody coming in today over 50, upon it, looking at MRI, you're seeing spinal stenosis. And so often patients, clients are thinking, here I have this disease called stenosis. And yet it's not something you're born with, it's something that develops over time. And probably at the forefront of this problem is postural distress, people collapsing their core, people sitting over the computer, taking an hour-and-a-half ride each way into the city, front and back, forward and back, and spending this whole host of time sitting, and it's breaking down your spine. Your spine is responding by developing more calcium to protect that area, to guard the area, and one day you wake up somewhere 4 or 5 decades down and you have spinal stenosis. But this disease process it actually affects people who are broken down in their posture. So it's an important conversation to start dealing with. How are you holding yourself? How are you holding yourself when you work, when you play, when you dance, when you commute? And probably the most important conversation we begin with is how you hold your core, how you stack your head over your shoulders, how your shoulders stack over the pelvis, and your pelvis over your knees and hips. And
as we talked about last time, posture is at the quote-unquote core of all of this.
Right.
You had a saying, what was that
right.
saying?
If you Google the term, sitting is the new smoking, it's just a host of topics of how sitting is related now even to mortality, high rates of mortality. It's frightening.
Right.
Sitting is the new smoking, and in fact, everybody's sitting today.
So what you're saying is the lumbar stenosis that we see in patients in their 60s and 70s may ultimately be the end result of poor postural positioning in their 20s, 30s, 40s, and 50s.
There's a whole host of thought that it's the way you hold yourself and the way you move, the way you posture yourself that ultimately will determine how effective and how strong and how capable you are when you move, bend, dance, play, lift. And when you're out of your center, that your muscles take over, and then you start to have this grinding, stressful pain in the muscles that ultimately will start to be transferred to the discs and to the spinal bones. And the bones and the body will respond by producing more calcium to protect that area. And then that calcium starts to grow into the spinal canal, and you find yourself with spinal stenosis.
Got it. So now let's assume we have a patient who's 72 years old and in fairly good health, who finds themselves now with a diagnosis of spinal stenosis. Maybe they complain to their primary care doctor that they have this back and leg pain, they get an MRI, they have it, and whether they see you first or me first, it's determined that we're going to initiate a trial of conservative or medical management before considering surgery. So what is your approach? What types of treatments specifically would you do with them to try to help get their symptoms treated?
So it's a multifold approach. First thing we'll do is look at the postural alignment of the spine. Spine is the part covers your central nervous system, covers the spinal cord. And if that spine is motioning and moving properly, it's centered properly, you're probably going to have the best performance. But sometimes we find that the spinal bones are out of their center, they're stuck out of alignment, and they're not motioning properly. So we'll address that problem as we see it. There's a soft tissue element. There's the muscles, the tendons, the ligaments that need to be addressed. Are the muscles lengthened properly? Are they conditioned properly? And then there's the concept of how to move. And so we'll initiate a series of treatment to correct those spinal imbalances. If they get to the end of this program and they're better, of course they're better, but if they're not, then we have to consider higher diagnostics, MRI, CAT scan. If the stenosis, the narrowing the spinal canal is pathologic to the point where it needs surgical correction, well, one of the ways we'll know that is that it's unrelenting pain. It's pain that does not go away. It's pain that does not recede back. They're not getting any benefit from the conservative care.
Right.
That's one element that says this may need a surgical intervention. If there is motor loss, meaning the muscles start to go weak and they're losing the ability to lift a foot, what we call foot drop.
Right.
Correct. Then we know that that's another step up, that the patient is moving into that danger zone of motor muscle loss. And the most advanced is when you get organs that fail to do what they're doing because the nerve flow to them is so altered that maybe they're losing function of urinary control or
Yes.
bladder control or bowel control.
Yes. Yeah, a lot of people don't realize that the nerves that travel to their bladder run through the same space that goes to the legs. And so it's certainly more of an urgent situation and more of a severe situation. But I've had patients who have basically presented with urinary dysfunction to the point where they're not able to urinate properly, and that becomes more of an emergency.
Absolutely.
And it can be caused from spinal stenosis.
I think that's one of the first questions on intake. Are you experiencing any changes in urinary patterns, any bowel functions? That's one of my red flags that say this is no longer a chiropractic issue. Now we're looking at something that may be of surgical concern and need to get on that.
I also find that lumbar stenosis sometimes can be misdiagnosed or underdiagnosed in the sense that not everybody with leg pain and problems walking has a problem in their low back. It may be in the neck. Sometimes you'll find that patients that have spinal stenosis in the low back also have spinal stenosis in the neck.
Right.
And so in the neck, it's sometimes more concerning because that actually compresses the spinal cord, which ends kind of somewhere in the mid-back. And not a lot of people realize the low back actually is not the spinal cord, it's just the nerve roots. And so a lot of times in our practice, we will image both the neck and the low back as well, because the problems can sometimes overlap.
And we're also looking at people visually and seeing problems. We sometimes patients come in and they've already have, even at a young age, they're already beginning to develop Dowager's hump, which is that hump that starts to occur between the neck and the upper back, and nursing home posture, as I call it, where the head is so far flexed of the shoulders, they have problems turning to the right, turning to the left. We're already starting to see the effects of a spine that's fusing and developing stenosis, and they may have pins, needles, tingling down an arm or hand or weakness.
Well, that's why it's just so important to get a full history and a full examination, because so many of these issues can overlap, and getting the diagnosis right is so important to selecting the proper treatment. Well, I'm getting the cue that we're running out of time. Thank you once again, Dr. Barry. Some of your insights been invaluable. And thank you for listening to another episode of Get Your Life Back.